So much for joining today. We are honored to be one of CB Insight's top 150 companies in digital health. So today, what I wanted to talk about is our vision for what is the future of digital health, and we think it's motivating. So I'll start by talking a little bit about my personal story, how I got interested in working in this problem, and trying to solve this problem of motivation. It comes back to my family history. So here is a picture of me and my aunt, Amy, back when I was a little bit shorter, back in the early 90s. And she is your model diabetic, right? To this day, she's been diagnosed with type 2 diabetes for over 20 years. She takes every pill as prescribed. She follows all of her doctor's orders. She's had no complications with her disease state over those past 20 years plus. On the other hand, my Uncle Roy, no matter what we tried as a family, we just couldn't get him to do the things that he knew he should and intended to and wanted to do. He just wouldn't follow through with them, right? He wouldn't go see his doctor. When he did see his doctor, he wouldn't follow their orders. He wouldn't take his prescriptions as prescribed. And he ended up with very different outcomes. He was very sick. He ended up on dialysis, and he passed away in 2016 after having a stroke. So you have these two patients, these two individuals that have the same exact upbringing, the same exact genetics, the same exact diagnosis, but massively different outcomes based on the motivation that they had to follow through with what they knew they were supposed to. And the problem is that motivation piece itself, right? We can create the best tools and resources for patients and give them away. But if patients don't actually follow through and use those resources, they won't get better. So this is what we see. The healthcare system in aggregate was created with what we call a classical economic model, right? So classical economics was what we thought was the prevailing wisdom from 1776 when Adam Smith wrote a book called Wealth of Nations, all the way up to the 1980s or so. And what we thought was humans are rational; they will do what's in their own self-interest. Since then, since the 1980s or so, we started to realize that's a false assumption. People make irrational choices all the time. So the whole healthcare system was created with this false premise that humans will follow through with what is in their own self-interest, this classical economic approach. And even the best, digital health tools are still classical economic tools, right? We're giving away more patient reminders or apps or coaching programs or smart devices. And the patients that use those things do better, no doubt. The problem is that patients like Uncle Roy lack that motivation to use those tools. So when we look at kind of this digital health ecosystem, we kind of see three different waves, right? Wave one was for those very motivated folks who wanted to be early adopters and track and optimize their own wellness, right? Things like Fitbit, Apple Watches, those sorts of tools. Wave two of digital health is where now we start to create huge value in terms of better health, better convenience, or better costs for patients that need to consume healthcare. But the problem is, these tools are great. They create a ton of value. The problem is that they only work for those patients who engage with them, use them, and follow through. These tools were for patients like my Aunt Amy. She will go ahead and use these tools and do better. What is still this left opportunity, what we think is going to be wave three of digital health, is going to be focused more on patients like Uncle Roy, those who are not motivated enough or engaged enough to adopt and use these new digital health tools. So what we really want to focus on is this wave three, this population that is not motivated. How do we create this new de novo motivation in them to get them to act, to get them to follow through with the behaviors that they should? So that's our big picture vision. Use this behavioral economic toolkit that's been proven, marry it with technology to create this motivation at scale. Adam Smith wrote about this invisible hand that guides markets and individuals towards rational outcomes. It doesn't actually exist. We want to be the thing that actually creates that true invisible hand to get patients like Uncle Roy to follow through and be motivated to improve. Here's a simple example. It's taken about 5 years of work and research to prove how to do this. But it's a very simplistic view of this is let's give them motivation up front. Let's endow progress. Say, hey, here's $30. That's already your $30. All you have to do is simply download this app and enroll in our program. That every day we're using that $30 of endowment as a loss framed incentive, right? So we're saying if you act today, you'll keep $2. If you don't do what you're supposed to today, take your medications as prescribed, track the metrics you're supposed to track, eat the foods you're supposed to eat, you're going to lose two of those $30. And by doing this repetitively over the course of time, we reinforce this behavior every time it happens with a salient reward as it happens. We start to form this really nice habit. Now, it seems very easy. It seems very simple. Behind the scenes, there's a ton of nuance. There's a ton of details. We're personalizing this program for every population, every disease state, every individual to maximize both their intrinsic and extrinsic motivation to get these right behaviors, to train into long-term habits so that we can help these patients reach the best outcomes they possibly can. So let's talk about how this is actually working. So this is a case study that I like to call Wealth in the Time of Corona. This is a recent example of one of our large clients who came to us and said, hey, we really want to support the highest risk portion of our population, those with multiple chronic conditions, those with a history of non-adherence, and in many cases also behavioral health or substance use disorder on top of that. So they had this goal of let's enroll 3,000 of these members while this pandemic is worsening and these high-risk members can't go in person and get care in their traditional care settings. How do we create the motivation for them to stay motivated on their own personal care journey and improve their own outcomes? So as the pandemic started, we started this population as kind of the shutdown started. So we started enrolling in early April of this year. Within 90 days, we had already hit the 3,000 patient goal of activation. And how has it worked since? Well, we've had 91% average adherence, daily adherence since these patients have been enrolled. If you see here, 76% of these members have been over 80% adherent every day. So I want to reiterate, all of these members were previously non-adherent. So we were able to enroll 3,000 previously non-adherent folks and get 76% of them back over 80% daily adherence. And most importantly, what has that done to outcomes, right? So there's been a lot of discussion about the COVID impact, right? What is COVID doing to utilization? What we can see here is on the left side, these are same members, but we're not given the Wealth program. There's been a 12% decrease to inpatient days in these members versus the Wealth members. The Wealth impact has been 71% decrease to inpatient days since this program started. So what we're seeing here is if you can actually remotely create this motivation at scale, you can drastically improve the outcomes. So that's our vision for where we are today and where the future of digital health is going. We're really excited about supporting more patient journeys, more disease states, working with more and more complex patients, even ESRD, CKD, the complex patient populations you can imagine. And we'd be really happy to chat about how we could work with your organization to use this behavioral economic toolkit to maximize patient outcomes. Thank you very much for your time today.
Welcome, everybody. I'm Mike Serbinas, founder and CEO of League. I'm a serial entrepreneur who's built global technology platforms across many different categories. And 5 years ago, we started League with a passion to transform healthcare. Health is without question the topic of 2020. While healthcare is in the midst of a revolution, what excites me most is the opportunity for acceleration. For employers who provide healthcare for the vast majority of Americans, workforce health is now mission critical. For the first time, it is directly correlated to business continuity and success. But despite the massive investment made in healthcare annually, the healthcare system continues to be a complex web of information, providers, employer-sponsored programs and plans, and that's difficult for both employers and employees to manage and make sense of. Access to healthcare services and support is often inconvenient and not consumer-friendly, and it can be prohibitively expensive for many. Many individuals struggle to understand and navigate the healthcare system. The focus of services on making sick people healthier rather than on prevention. And as a result, most people fail to get connected with the right service at the right time. In many ways, healthcare is stuck in the past, and it looks a lot more like my grandparents' cable TV when the world expects a Netflix-style experience. And so when we say that healthcare is in the midst of a revolution, what we're really talking about is that it's in the midst of a technology revolution. We see it across the enterprise. We see it in big tech suddenly making moves, as well as increased M&A and capital markets activity. Consumers are looking for one place to go, one place to access and pay for care, and it's clearly time to redesign healthcare through the lens of the consumer. At League, our bet is that empowering the consumer is the key to better healthcare outcomes and economics. Our vision is about empowering that end consumer with a healthcare experience that's digital, personalized, preventative, and always on. Making this experience happen is an important part of the end consumer's outcomes and the economics, and it's got to be scalable. And to make it scalable, you need digital infrastructure for health. We've seen it time and time again in different industries, and now in healthcare. League is that infrastructure. We've built a health operating system, a health OS, that meets the consumer where they are, whether that's at work, at a pharmacy, at a healthcare provider, or elsewhere. For employers, this is about a consolidated experience that brings together all aspects of health, benefits, well-being, and connecting it to the enterprise seamlessly. Gives employees that one place to go, that personalized experience. And it's an experience that employees actually love and actually use. NPS scores in the 80s, engagement in the high 70% of all employees showing up every month, as it makes healthcare easy but also personalized, leveraging data to connect people to the right programs and services at the right time. And that drives savings and better outcomes. It includes virtual care built in, including a team of registered nurses, care navigators, benefits experts, and more available in real time. And that provides a direct line of sight into the health of their workforce. It also provides a real ROI, historically delivering a healthcare experience that people love and managing costs are competing priorities. But with a health OS like League, they go hand in hand. Best-in-class platform engagement rates with a proven ROI model. We've also developed an offering for other actors in the healthcare ecosystem, which is all about accelerating their digital transformation. League provides the digital infrastructure to enable the digital transformation for health plans and advisors, healthcare providers, pharmacies, and governments. And we call this our Powered by League platform. With it, League powers branded applications and services with modular capabilities that are really tailored for each partner. And this accelerates the time to market and the impact that these partners can have with their customers. With a platform as a service model, League can enable a multitude of applications, leveraging the powerful capabilities of a health OS via web services or APIs. This includes personalization, commerce, health services, digital therapeutics, virtual care, health profile, machine learning-based analytics, and more, all available in a modular way. And of course, this is data platform and cloud agnostic or multi-cloud. A sample partner solution leverages all the unique attributes that a partner brings to the table, combined with League's Health OS for rapid deployment, a branded and personalized experience for that partner and their customers and their unique market. So we are here to help accelerate this consumer-driven healthcare revolution for employers, for payers, providers, and all members of the healthcare ecosystem. And you can learn more at league.com, or you can connect with me directly at mike@league.com. Thank you and enjoy the rest of the conference.
Hello, I'm Deborah Bass. I'm the U.S. President and Chief Marketing Officer of Nuovo. I'm excited to introduce you to Nuovo, to shine a light on the intractable problem we solve, and to reveal our technology solution. So I'm starting with a little bit of executive summary for context. So pregnancy care is a large, dynamic market ripe for disruption. Shockingly, there's been no meaningful innovation in this space for 50 plus years, and millennial moms deserve better. Second, our technology has recently received FDA clearance for our first offering to deliver fetal viability checks virtually. We have another offering currently in the regulatory pathway where we will expand our virtual visits to eventually also include remote non-stress tests. The COVID-19 pandemic has been a lightning rod for telehealth adoption broadly and pregnancy telehealth adoption in our case. And then last, Nuovo's a commercial stage company that has the US earmarked as our lead market, and we're just now getting our footing in the US lead market. So we talk about a multifaceted problem that we really vet through three discrete lenses. So first, the US has the dubious honor of being the most deadly developed nation to give birth in. And why is that? There's rising mother mortality driven by complicated pregnancies. There's unsustainable costs, $50 billion plus, distorted by these complicated or high-risk cases. And just when we need more care, there's a shortage of OBs on the horizon. Today, 50% of US counties have no practicing OB, and that number is increasing. Secondly, we have outdated tech and tools. Pregnancy is a fragmented journey. I, as an expectant mother, have no idea what's happening with my fetal health in between episodic doctor visits, and I'm worried about it. Legacy technology, notably Doppler and TOCO, have poor data. And then last, it's a disconnected episode of care at a time where we really need whole patient care, not only OB as quarterback, but also having one cohesive data picture for other supporting doctors and specialists like the primary care physician, the cardiologist, the psychiatrist, etc. And the last lens on the problem is a burden of experience. And we really look at this as a pre-COVID and a midst COVID world. So pre-COVID, I, as an expectant mother, would leave my place of employment or young children at home to travel by car or public transportation, to sit in an infectious waiting room, to get plugged into a wall for my routine monitoring sessions, and if I'm high risk, multiple times a week. And then boom, COVID hits, and suddenly OB clinics are closed or have restricted access, yet pregnant women cannot go unchecked. This is not like an elective surgery where I could delay it or defer it for 6 months. So COVID has been a forcing mechanism for telehealth adoption, and it started with televisits, almost like a video technology, how I look at you now for a consult, but Nuovo is deepening that with our remote monitoring solution, InView, which I will introduce to you now. So we have a 21st century platform for pregnancy monitoring and management. So Nuovo has created InView, which has three components of the platform. The first is a wearable sensor band to wrap the uterus and fixed location sensors and essentially record the womb environment. The data through a Bluetooth connection on my phone gets uploaded to a cloud computing environment for digital signal processing, big computational power, and then there's a visualization layer where my dashboard is shared with my OB team through connected apps. We talk about making the mother the point of care and having data seamlessly connect visits across the home, the office, and the hospital environments. So what data do we collect? We collect deep physiologic measures, starting with what's known as standard of care today, fetal heart rate, maternal heart rate, and uterine activity or contractions. And this will allow us to offer remote monitoring of prenatal visits and eventually of non-stress tests. But Nuvo is actually going much deeper than that in our data collection. And ultimately, we will be able to create high fidelity maternal and fetal ECGs, understand sleep patterns, breathing patterns, combine this with external data sources to go from distributed care today, where we begin to shift a portion of visits from the office to the home, to personalized predictive pathways for better management tomorrow. And with that big data AI capability, be able to predict and triage things such as preterm labor, preeclampsia, mood disorders, etc. Really exciting to revolutionize a space that's been underserved clinically from a patient experience standpoint and economically. So how do I get access to InView? InView is prescription initiated and protocol driven. I can get my prescription in one of two ways. I ask my doctor for InView, or my doctor says, Debbie, you're an excellent candidate for InView. A portion of your visits will be scheduled virtually. In either instance, I get my script, I go home, I log on to nuvocares.com, and two things happen. One is I get paired with my OB team in the system for scheduling, and two, Nuvo ships me my maternity kit in a box, which includes the sensor band and any peripherals my doctor may prescribe, most likely a blood pressure cuff. I complete my virtual visits according to doctor protocol. So a couple times a week for X minutes a session. When I'm done with my episode of care, I ship my sensor band and peripherals back to Nuvo, and we can decontaminate them, refurbish them, and ready it for the next patient. We take all of the hassle away from the OB team in terms of inventory management, logistics, and customer service and support. I want to close with a very inspiring quote from Dr. Stephen Klasko. So for perspective, Dr. Klasko is a newly appointed Nuvo board member, chairman of Jefferson Health, an OB by training and practice, and part of the vanguard of telehealth. He's authored a narrative, Healthcare with No Address, very provocative. So Dr. Klasko has said, healthcare will never be the same. There's no chance that a pregnant woman will want to have routine monitoring the old way, going back and forth from the hospital, when Nuvo can allow her to be monitored in the comfort of her own home. Millennial moms and practitioners deserve a 21st century solution.